If you know a woman, this message is for you. The truth about what happened was criminal. It was 2002. And my waiting room was filled with angry women. They were old and young and friends and wives of colleagues. But as the only female provider, I got the brunt of this decision. In those early years of practice, prescribing and managing hormone replacement therapy taught me firsthand the difference it made. Insurance covered the prescription costs for hot flashes, but it worked for mood and memory and sleep and libido and bones and heart disease and just the overall well-being of women. Then the WHI study hit the headlines, and they were terrifying. Hormone replacement therapy causes breast cancer. I was skeptical, but the spin was too powerful for me to stand against. Within weeks, my colleagues stopped prescribing HRT. Our nurses said, we need emergency meetings to say, what do we tell the patients? Pharmacists couldn't refill prescriptions fast enough. Patients were panicking. Some threw the pills out after reading the headlines. Others started stockpiling them and hoarding their pills, vowing they would never stop their hormone replacement therapy. Doctors, myself included, were scared. The whisper of malpractice suits had us afraid of writing the prescriptions. Imagine this, a patient storms into the clinic. She's exhausted, tearful, hasn't slept in weeks. She can't stand that these hot flashes have just wrecked her life. She now stands outside half naked because she cannot regulate the temperature. She's snapping at her kids. She can't stand the sight of her husband. And the one prescription that I could write to make all that go away is off the table right now. I had another woman who, standing at the bus stop, broke her hip. No warning of pain, no trauma, just snapped. This is what happens when estrogen leaves the body. Humans and whales are the only two species that live a long time after menopause. But there are serious consequences to your bones, your heart, and your brain to live without estrogen. My own mom asked, should I stop these hormones? And I told her the truth. The same thing I told patients behind that closed exam room door. Stay on them. Women paid the price. But how did this happen? Well, it starts with the WHI, the Women's Health Initiative. In the early 1990s, it was the biggest, most costly study to date. Over 160,000 women had enrolled, and the question was, could HRT prevent chronic disease? Now, let me be clear. That's not asking the question, do these hormones help with hot flashes? Do these hormones make the woman feel better? This was a question of prevention. The study was focusing on the prevention for postmenopausal women. The average age for a woman in that study, 63. That's a decade after most go through menopause. But here's what no one told you. According to Dr. Joanne Manson, who was the lead investigator for this trial, when it came to messaging to the public, the investigators were left out and it was handled by the leaders of the National Institute of Health. What got released to the press? Risk of breast cancer, stroke risk, and HRT causes heart disease. Where did they get those headlines? They used relative risk and they sensationalized it. But the absolute risk to the patient was less than 1% for these problems. Most of the risk was in older women, many of whom already had plaques established in their arteries. And women under the age of 60, those within 10 years of menopause, well, HRT was shown to reduce their coronary artery risk and their overall mortality. But that wasn't the story they told. They made it black and white. Hormones cause cancer. Hormones cause heart disease. I give this full lecture on stage at several of the conferences that I'll be speaking at, and I'll have some other videos coming out. But your comments will help me know, did I answer your question? Please leave me a comment on what questions you have about this topic.